My name is Shelley Samuels. I'm the principal at SRS Strategic Associates. I am presenting today with Linda Mayo, our senior associate. We are doing this because we want to give back to our community in a meaningful way. Hence this series of webcasts that began on 4/15 about grants. Then we did one on business continuity at the end of April. And today is our final webinar on business growth and sustainability. The mission of SRS is to assist organizations that serve individuals with disabilities and special needs to become and remain sustainable. We provide services related to funding, grants, third-party payers, quality, compliance, accreditation, as well as business operations such as EHR, fee-for-service, integrated care, and feasibility assessments. We work in the human services and healthcare space. A little housekeeping as we begin. Everyone, we're using, as I said, Microsoft Teams for this presentation. You'll be able to post questions through the Q&A function throughout the presentation. We will respond to questions at the end. Please take a moment now and locate and select the Q&A icon on the top right of your screen, if it's not already open. Next. Next slide. As I said, my name is Shelley Samuels. Just to tell you a few things about myself, I have 30+ years of experience as a leader in human services and healthcare organizations. Most recently, I was the COO and compliance officer for a national autism organization. Prior to that, I was the chief program officer for Easter Seals, New Jersey, while concurrently serving as the COO of Easter Seal Solutions, an EHR systems administration entity for multiple nonprofit organizations. I have an MPA in public administration with a concentration in healthcare finance from Rutgers. And I also completed an executive leadership program at Columbia University Graduate School of Business and a program at NYU Stern School for executive education in finance and accounting. I've secured many $1 million of federal funding, state, local, and private funding. I've served as a management and development consultant for organizations such as federally qualified health centers, medical centers, hospices, and health and human service organizations. I've provided consultation on medical legal partnerships and older adult services, and I have expertise in fee-for-service and transition to multiple payer models. Linda, why don't you say a few words about yourself?
Great, thanks, Shell. Hi, everybody. Thanks again for being online and for your patience as we work through some of the technical difficulties, which I'm sure all of us have been going through the last couple months. So I've spent the majority of my career working for Easter Seals, and at Easter Seals, New Jersey, I served as the COO position in charge of programming, behavioral health, residential and support services, as well as HR and information technology. At National Easter Seals, I served in executive leadership roles and worked both in the DC office and in Chicago. I'm an MSW. I specialize in administration and also have a master's from NYU in nonprofit management. In New York, I worked for quite a few years. I was the executive director of an HIV/AIDS organization that served all the boroughs. And I also worked up in Montefiore Adolescent AIDS Program in the Bronx, administering HRSA, CDC, SAMHSA, primary care and community research grants. Finally, as a consultant in New York City for 6 or 7 years, my clients included health centers, universities, and myriad nonprofits. And I did a 9-year stint out in San Francisco. I worked in 3 different colleges over 9 years at San Francisco State University, where I administered community-based research programs. And most recently, when I came back to New Jersey, I worked as an executive director at a New Jersey home and community-based organization where I restructured the programs and services, moving from the grants and contracts, which many of you I'm sure are very familiar with, to fee-for-service, and implemented the new EHR and a brand new finance system, and with a focus on integrating our behavioral health services throughout the entire agency. And to sum it up, my passion is health and human services, which serve to reduce health disparities within our communities. My expertise is creating and sustaining organizational infrastructure. And last year, I obtained a certificate in Six Sigma to enhance my skills to implement effective quality assurance, compliance, components, and workflows. So that's our bios, that's our background, and let's get started. What we wanted to say to you is being on this webinar means that you have survived and are planning to situate yourself and your organization for a higher quality of services for your consumers, your staff, and your volunteers. And for you to take the time today to take stock of the amazing strides you have made to date to improve your current plan and how you will decide on your plans for the future. As we developed this presentation, our intent was to provide macro and micro views and provide ideas and information that will assist you today and into the future, and this will become more apparent as we move through the slides. Shelley and I encourage you, this is important, encourage each of you to stay focused as much as possible throughout our time together. Reduce as much distraction as you possibly can given your role and responsibilities. We know we're pulled in so many different directions, but you've set aside this time and you need time to focus on the future, take pride in the areas that you are currently doing well, those you want to improve, and on those you want to develop in the future. Now, we're going to spend very little time on COVID, but unfortunately, I am going to bring up a slide that says early impact and outcomes of COVID. What we wanted to do just is to provide and discuss the environment we're currently in. And it was important to recognize what has occurred for many of us at the onset of the crises. And we all know the devastating impact on the consumer, staff, and families. It's almost beyond comprehension. The service impact has been exponential in the increase in the need of some services, and just a couple examples: food banks, telehealth, medical care, and the inverse of decrease, pause, or closures of others, such as day programs and in-person support. Again, and this is the early impact of the pandemic. Our challenges in procuring expensive PPE equipment, which has really been extremely difficult, challenging, and stressful, not to mention unbudgeted in all of our budgets, and the rapid transition to remote work, and the rapid transition of telehealth and telecommunications, both internally and externally. And of course, which is kind of where this all started, when we were talking about preparing for the epidemic at that point, before it was considered a pandemic, major social distancing and quarantine challenges, certainly in our residential programs and office settings. And last but not least, the exponential financial ramifications. We're just setting this up as a framework of how we're going to be talking about some of our challenges, but then get into the meat and potatoes of how we're going to help guide some of your thinking and decision making to move forward. Just very briefly again, I wanted just to talk about an ANCHOR survey that was just conducted in April. ANCHOR is the American Network of Community Options and Resources. I'll just jump to the two bullets. 68% of all of the 689 organizations reported they had to close one or more service lines due to the pandemic, resulting in an average loss of revenue of an unbelievable amount of 32%. And 52% of these organizations surveyed reporting having increased staff overtime expenses. I'll insert here that the La Piano Consulting Group that operates out of New York, they also did a survey of 433 nonprofit execs, and they were forced to modify or outright cut services. And in terms of staff, they had laid off an average of 19% of their staff and moved 83% of their operations to work from home. And of course, that required unbudgeted IT investments. And they shifted 79% of their programs and services online. So the second bullet there is Alvear Health, who conducted the survey, also talked about people's limited cash reserves and how long people really can stay in business without the emergency funds. One last survey by the National Council for Behavioral Health. You can read here, mental health and addiction treatments providers estimate they'll lose $38.5 billion in revenue just this year. 60% of providers have been forced to close one or more programs. And in Kentucky, more than 85, that's pretty astounding, of providers have already closed programs. And providers in the states ranging from Arizona, Michigan, PA, and New Jersey have already shut their doors. 62% of providers can't survive more than 3 months without emergency financial assistance, and 80% of South Carolina providers, and nearly, this is unbelievable, 90% of Florida providers expect to close their doors by July. So on the more positive note, I'm going to turn it over to Shelley, who's going to start to talk about what we can do and what's important to focus on during this really unprecedented time. Shelley?
So what we hear from providers is that how tough it is to make the hard decisions every day that you need to make. Every day is different now. It's hard to get into a routine. But as leaders, we always have to think about the here and now and the future at the same time. This is the one constant. Our team, clients, board, and stakeholders count on us to set the course for the future. It has to be realistic. Some may decide that a specific program or the organization itself cannot make it on its own after this. Many look for partners or may turn to other businesses to take over parts of their organization. We believe your first decision has to be to start making these decisions now. We have to believe it can be achieved, and it has to be believable. It has to be the truth, not magical thinking. We will be in a demand exceeds supply environment. If this were in the world of commerce, if we were in that world, we might want to follow the laws of supply and demand and increase our prices. While that might happen, we might want to work towards that. It sure isn't something we can count on since it's largely out of our hands. So the one thing we can do is we need to increase supply. We're going to talk about how to do this successfully. So we are hoping to give you a break from all that is going on and focus on the light at the end of the tunnel. A positive message, what you will do when things stabilize. But first, let's talk about the decision-driven process. Next, Linda.
Thanks, Shal. I appreciate that. The decision-driven organization. So there's going to be 7 steps, just to give you the heads up here. So think about your decisions and what is happening in calm times, crisis time, and your day-to-day operations. So really take these tenets to heart and really think about how this pertains to you. This came out of How Clear Decision Roles Enhance Organizational Performance from a Harvard Business Review winter edition of back in 2015. And I've referenced this often throughout the years just to help me stay focused and really think about how I'm going to implement and work on making better and more efficient, effective, and faster decisions. So starting with number 1, some decisions matter more than others. That may sound obvious, but what they outline here is decisions that are crucial to building value in the business are the ones that matter most. And hark back to the building value in the business. Those are your prioritizing. We're always taught about prioritizing the things in our business. And the second bullet is some of them will be the big strategic decisions, but just as important are the critical operating decisions that drive the business day to day and are vital to effective execution. And heavens knows how many decisions you've had to make over the past 2+ months on a day-to-day basis in a crisis environment. So number 2 is action is the goal. Action is the goal. Good decision making doesn't end with the decision, it ends with the implementation. It's that follow through. The objective shouldn't be consensus, which often becomes an obstacle to action, but buy-in. What you've got to do, I recommend highly, because this is what is helpful to me, is to just cancel out the naysayers. You certainly want input and you want to know what people have to say at different levels of the organization. At the end of the day, if you're in leadership position, you have to really think about those decisions and creating the buy-in, but not necessarily consensus. That may drag you down. Number 3 is ambiguity is the enemy. Clear accountability is essential, and that entails communication, as we all know. Who contributes input, who makes that decision, and who carries it out? That's really key in working through your decision-making processes. Without clarity, gridlock and delay are the most likely outcomes, and really none of us can really afford that gridlock or delays during these rapidly changing times. Clarity doesn't necessarily mean concentrating authority in a few people. It just means defining who has responsibility to make decisions, who has input, and who is charged with putting them into action. Number 4, speed and adaptability are crucial and most difficult, admittedly, right? That's very hard for us. A company that makes good decisions quickly has a higher metabolism, which allows it to act on opportunities and overcome obstacles. That couldn't be truer in these days. The best decisions made quickly allows organizations to act on opportunities and overcome obstacles. The best decision makers create an environment where people can come together quickly and efficiently to make the most important decisions. And number 5, decision roles trump the organizational chart. No decision-making structure will be perfect for every decision. They've got to be tailor-made. The key is to involve the right people at the right level in the right parts of the organization. And that takes time. You have to pause and think and make sure that you have the right folks at the right level in the right part of the organization to help make those decisions. And a well-aligned organization reinforces roles. Clear decision roles are critical, but they're not enough. If an organization does not reinforce the right approach to decision making through its measures and incentives, information flows, and culture, the behavior won't become routine. And obviously not embedded in the organization. And last but not least, practicing beats preaching. You know, I always say, boy, I really blew it today, or I really didn't do a good job on that, but I always know that tomorrow is going to be a new day that I can practice again. And when I think about decision making, I really have to not beat myself up, but I have to think about who are the people who will live with the decisions. This really helps me to focus and prioritize. Involve the people who will live with the decision roles and designing them. The very process of thinking about new decision behaviors motivates people to adopt them. So it's really that, again, harking back to the buy-in. A decision diagnostic, we're not going to go through this. I would love to, if we had time, to do this as an exercise, but this is something that we may be able to provide to you after this webcast today. because this is something that you could take and pause and when you have some quiet time early in the morning, in the evening, and with a pad and pen or your computer, consider the last 3 meaningful decisions you've been involved in. Ask yourself the following questions. And this is really helpful, and it might sound excessive to do 3, but it is really helpful. Were the decisions right? Think about that. Write some notes on that. Were they made with appropriate speed? Were they executed well? Were the right people involved in the right way? Was it clear for each decision? Were the decision, roles, process, and time frame respected? Were the decisions based on appropriate facts? I'm going to go back to number 6 for a second, where we talk about the time frame respected. Oftentimes, our team members, we think we're going to have a decision sooner than is realistic, and we give a earlier time frame, and then we miss that time frame, and that leads to disillusionment and upsetness and confusion. So I think number 6 is something to really focus on. Going down to 8, to the extent that we were divergent facts or opinion, was it clear who had the decision? Making that clear, who had that decision. Number 9 was, were the decision makers at the appropriate level in the company? And did the organization's measures and incentives encourage the people involved to make the right decisions? Again, this is something that I would encourage you to do at your leisure and really think about things through. It may help you future forward. Shelley?
Thank you, Linda. I found this interesting, looking at what will you do when things stabilize. These 4 bullet points are actually from New Jersey Business Magazine. And when you think about it, they're really geared towards, commerce, for-profit business, but aren't these things all very, very similar, if not exactly the same, as we have to be looking at in our community? Demand for service will be there, but maybe for delivery in a different way. Maybe the permanent use of telehealth. Maybe the day hub you have will now only be community-based with small groups. Maybe congregate living won't be so congregate anymore. Besides how to adopt to the change, do you want to adopt to the change? Not everyone wants to make that move. Not every change may be in line with your mission and your organization, and may choose not to do it. It is predicted that organizations will close or reduce their footprint. We saw that on earlier slides that Linda presented. But those that can and do choose to change and do it creatively, which is imperative today, and still meet their mission, may have the best opportunity for success and growth. And I think that that's the kind of key message we're trying to give today. A way that we recommend to approach it is to look at mission, impact, and financial stability. Next slide, Linda. Okay. So this is a tried and true method for building on your core competencies, for growing your organization and your services. It's recommended that you look at the same population, but maybe adding different services. Or you look at a service you're providing and you add a different population. One example of that might be, you might run a day program of some sort, and maybe it's for adults with intellectual disabilities. And now you decide to add another population, say adding a senior adult daycare to that program. You will use knowledge, expertise that is held or acquired to do service delivery. And you will use knowledge, expertise held or acquired to serve new populations. Next slide, please. You've probably seen tables that are similar to this, usually related to assessing strengths and weaknesses in a decision-making process. If you utilize the strategies and recommended course of action in this presentation today, you should be able to use this diagram to confirm your growth decisions. So if we are going to be sending the slides out to everyone who signed up for the presentation today. And when you get to the end of, if you use our materials, to the decision-making process, this is a very good slide to go back to see where it falls in terms of mission impact and financial sustainability. Next, please. All right, so one thing that does trick people up, and probably is one of the least favorite things that people have to do, is knowing your unit cost analysis and how to do a unit cost analysis. And this is very important because you may end up with a unit cost where you have a profit or a surplus of 5 cents per unit. And you may say, that's ridiculous. I'm not going to continue to do that service. But let's say you're doing 500,000 units of that service, then it may very well be worth it. But it's very hard to know how to grow a service that you're already doing or do a new service if you don't know what your unit cost is. You should have received the worksheet related to these next 2 slides with your meeting attendance reminder today. This sample that's in that worksheet has to do with primary care medicine, but you're going to see that the principles are really exactly the same. The first step is to define your unit. Under fee-for-service, this is pretty much already done for us. But if you're working outside of fee-for-service, this is something you will need to take on yourself. Second is the number of units you want to, determining the number of units of service provided. This is a case where you should not use magical thinking or wishful thinking. You need to really look at the number of units of service that you can realistically provide. There's a lot of estimates out there about what good productivity numbers are, percentages, and of course it varies by service. But I'm just going to say that I think if you're somewhere in the 65 to 70% range, that's probably good under the current situation. The third is to calculate the direct costs. So these are the costs that are direct, such as staff, rent, in other words, more fixed costs. Next. Calculating indirect costs. This is one that throws a lot of people because it's not always so obvious. This is where you may want to engage some accounting assistants or someone else on your team that really understands the number, because these costs are often shared among programs. The next one is calculating depreciation and the value of donated goods and services. Again, you probably want to reach out to an accounting professional for this. There may be things that you don't even realize that you should be recognizing as donated goods and services. And finally, determining the full cost of the unit of service. In this step, you will be taking steps 3, 4, and 5, adding them together and dividing them by step 2. And once you've got this method down, you can then use it much more easily for any service that you are looking at for the future. Next, please. So we're going to insert a little levity here by describing the path to implementation of a new service as a road trip. I thought we could all use a little bit of levity at this point. So these are the things you need to think about. So you've decided, based on your decision making, what you want to do. It's going to be cost effective. And as Linda said, it's not just enough to make a decision what you're going to do. You then have to implement it. And that's what we're going to talk about here. So the first thing is, why? Why are you going on this trip? What are the goals? What are the objectives? And you always have to create a roadmap. You're not going to be able to rely on Google Maps or anything for this. This one you're going to have to do yourselves. A simple way to do it is to use a Gantt chart. You can find samples of Gantt charts on the internet, but it's basically a bar chart that illustrates the project schedule. You're going to be constantly updating this. Where are you going? So here is where you want to acknowledge what it is you intend to accomplish when you get there. You always want to have in your mind's eye what the accomplishments are that you want to achieve. Who's going with you? Include participants in the planning and execution. I'm sure most of us realize, and maybe early on made some errors where we kind of came up with a roadmap on our own and then asked people later. It is so much better, you need the buy-in, is if you get the participants included in the planning and execution of the road trip. Then what are people's roles? Who's the tour guide? Who's the drivers? Who's the passengers? Who's the navigators? You need to have some roles will come about naturally and some will need to be assigned. Pack smart. Do your best to anticipate what you will need to take with you to get to the end of the trip. Next slide, please. When? When do you need to get there? You do have to have some due dates at the end of when you want to achieve this plan. And then you may take some side trips. There may be some other things that you have to address that you didn't realize at the beginning of the trip. And there may be other planned stops. And always you want to note milestones. It's very good to celebrate milestones with those that are on the trip with you. Roadblocks and detours. Every trip has roadblocks and detours. There is never a time when you just are going to map out a course and that's what's going to happen. The cost. It's not just a matter of what the costs are to operate the service, but what are the costs involved in the implementation plan. And document your adventure. Always keep the project plan updated. Always keep a list of lessons learned along the way. And continuously updating of the travel plan. Project plans, this is a live trip, and you should expect to have changes along the way. And please celebrate the journey. Next slide, please. So we're not going to talk a lot about marketing, but I didn't want to leave this out because regardless of the times that we are in, you still need to have a marketing strategy. Once you're convinced that you're ready to position your organization for growth, it's time to sell the idea to your stakeholders. So we wanted to briefly introduce this concept. There will be more of a need to tiptoe through marketing now. Lots of people are in an overwhelming adjustment stage and won't be able to hear the messages we might have given in the past. Here is what we believe the main messages to be today. That you're going to offer this service with safety, you're going to have precautions in place, there's going to be a lot of communication, and that there will be flexible availability. And remember that your marketing is not about you, it's about them, your customers. And in general, marketing has 3 legs, and you always want to be utilizing at least 2 of the legs in your marketing communication. And those 3 legs are quality, service, and price. Next. So we've gone a little faster today just because we wanted to make sure that we didn't keep you too long. And we wanted to end with this slide. This is a quote from Christopher Reeve. A hero is an ordinary individual who finds the strength to persevere and endure in spite of overwhelming obstacles. Well, haven't we seen this? Because we know that all of you that are providing services are really the heroes of the day. And just a few final messages. What you do, like in medicine and primary healthcare, is essential. and therefore there will always be a need. Now is your opportunity to demonstrate your organization's strength and resiliency. Now be your opportunity to pivot, to do things differently, and give access to more people and expand what you do. This may be the time for true partnership. As leaders, we always have to think about the here and now and the future at the same time. Linda, the next slide's yours.
Wow, thanks, Shel. So now, actually, we're going from that very nice inspirational quote from Christopher Reeves and your nice closing thought, Shelley, thank you, to just a quick advertisement. We just wanted to make sure that we inserted this opportunity to get it out to the broadest audience about Edison Township has funding available for housing units for people with special needs. And SRS is instrumental in this process, and we would be thrilled if you are interested in learning and pursuing funding for housing funds and for home generators and emergency repairs to contact us. The next slide is going to actually have another phone number, but if you want to take this down, you can call 609-642-2282. What we're doing with this opportunity or initiative is providing assistance directly to a provider and or developers to obtain this funding, and we're doing that with free assistance through our we're having a resource desk, and we have a funding toolkit. So basically we can help you step by step to get through the process. Again, it's pro bono for these services and get you involved in housing opportunities in Edison Township. They have over 125 units that they actually, through the affordable housing funds, that need to be given out. So that would be great if you wanted to contact us. And then also you could contact us at specialhousing@srsstrategic.com. And I'm going to go to our last slide because we're going to go to questions and answers. And before we go to the chat and look at our questions and answers, Shelley and I really want to encourage you to send us your thoughts about today's presentations and ideas you would have for future sessions. So we're going to go over to our questions.
Okay, we only have a couple questions. Hopefully that means we were so terrific. But all the questions are basically around the same thing, which is people asking after they've had a time to review this, could they contact us for more information? Yes. We are always happy to give complimentary consultations to people in the provider community or anyone who's interested in any of this material. And of course, as we said, we will be getting the slides out. So feel free to contact us if you'd like to have a conversation, in more detail about the presentation. And again, we want to thank you all very much for joining us. It's been our pleasure, and we hope to connect with you again soon in the future. Thank you.